most of the kids that we are seeing in our mental health department, so I'm the internal mental health department at Project Harmony is kind of what I oversee as part of response services. So the kids that we are seeing are either victims of abuse, or we see siblings and then protective caregivers as well. We also have therapists who are dedicated to our missing youth population. So we see our youth who have a history of running behavior, who are non-system involved, and then we have a new program for trafficking, so for anti-trafficking, and we have a therapist who sees some of our suspected youth who've been involved, or youth who've been suspected of being involved in trafficking. And so that's primarily the populations we see. I would say just nationwide, there has been an increase in things like anxiety and depression with kids. We know that school was a stabilizing factor for kids. There was a lot of structure with that. And relationships and supports that when kids went home, those went away. And so I know that once kids were back in school, we are seeing just a lot more difficulties and stresses for families, as well as jobs and things with parents, and just it's an impact of the whole family system. So we're dealing with cases who are in acute crisis on a regular basis, but then you add the layer of the pandemic on top of that, and that's just an added stress that just makes everything more complex and complicated for families.
I was going to add on kind of from what we've seen in the prevention perspective is kind of that isolation that kids and families experienced during COVID, which created some social anxiety. As Joanna said, we've seen a lot more referrals in our Connections program for younger children with anxiety and not really having the skills to acclimate back into this in-person school setting, and social friendships that were lost or that have had to be reestablished during that. And then isolation of families in general when they weren't able to go to supportive kind of services in the community. Joanna also mentioned like the financial strain on parents, which created some additional household stress that we've seen some kids having reactions to. And then it's not necessarily mental health, but the academic gaps, I think, are really starting to show themselves.
I think that we're seeing a very much a dampening on the stigma of mental health. And I think going through the pandemic with all of the support and all the communication through media and other outlets to say, get that support, schools, are way more open to the mental health and referrals than they ever were before too. So there's almost begging for help because of how significant I think children's behaviors were and because of how much families were struggling.